It is pleasure to introduce Dr. Kunal Waghray, a distinguished pulmonologist and critical care specialist. As the director of Respire Airway Clinics, Dr. Kunal is a super specialist with a DM in pulmonary medicine and advanced training in interventional pulmonology. He is widely recognized for his expertise in treating complex lung diseases, including asthma, COPD, and sleep apnea, as well as his proficiency in advanced bronchoscopic procedures. Known for his patient-centric approach and commitment to evidence-based medicine, please join me in welcoming Dr. Kunal Waghray. Dr. Kunal, before we start about the Respire Airway Clinic, I just want to ask you, what are the common problems that people face either with the breathing or with the hearing or with the sleep issues? Like not just facing the common issues, but what are they most frustrated with in the market today?
So what I'll tell you is most patients feel like related to breathing or issues with sleep or something to do with the ENT. The most common issue what patients are facing is fragmentation. So they are referred from one specialist to the other specialist for a issue which is actually a part of the same airway. So that's why we take care of the patient as a single airway system. Like if you take pulmonology for the lungs, ENT for the ear, nose and throat, and also we have one more pillar in our system related to the sleep medicine. So what I would say is the most frustrating thing for the patient is they are referred from one specialist to the other for issues which are actually related to each other. So in that process, what happens is they often feel very unheard, and ultimately the treatment is becomes very symptom focused rather than patient focused. So that is one issue what patients are facing, and we at Respire we have all the specialists at one place, and we eventually connect the dots and treat the patient as a whole and not just the symptom.
Okay, so with that reality in mind, at what point of time you felt like you have to start Respire Airway Clinics?
Yeah, so exactly as I had mentioned before, the issue with this specialist focused treatment, that is what is happening in the market today. You go to any corporate setup or for that matter any clinics if you are visited in the city, they are all focused on a single specialty. Like you have some issues with breathing, you straight away go to a pulmonologist. You have any issue with with your ear, nose or throat, you go to a ENT specialist. So what we thought is, and also the third pillar as we had mentioned, it's about the sleep. So sleep is something which is related to both the lungs as well as the ENT specialists. So ENT they deal with the upper airway and the pulmonologist deal with the lower airway. And issues with both of them can cause issues with the patient's sleep. So ultimately what we saw in the market is patients who are having these sleep issues, they are running around from ENT, pulmonology, neurology, ultimately having no proper answer. So with that in mind, we came up with the idea of Respire Airway Clinics, that we want to include both ENT, pulmonology as the main specialties, along with special emphasis on the sleep, and then we treat the patient as a whole, so that both these issues are tackled with, and ultimately the patient is benefited.
Perfect. So you said if you go to the normal clinic, an ENT clinic or the pulmonology clinic, it is fragmented. But
Exactly.
but what if a patient goes to a corporate? Would they get the integrated care over there? What kind of benefit they get by if a patient chooses Respire Airway compared to a big corporates?
Yeah, so big corporates, the thing is there are multiple specialties there, even in corporates, I agree. But one thing is commercial practice. The issue with corporate is they don't provide holistic care to the patient. Corporate hospital deal only with the medical side of it, not with the psychological and the functional point of it. So we here at Respire, apart from the routine ENT and pulmonology that we had spoken about, we are also attached to certain rehab centers which provide you with proper sleep hygiene. They'll guide you to a proper sleep hygiene. Also, we have with us, we have empaneled with us certain labs which you do your home sleep apnea testing. So you don't need to be admitted to a hospital for it. So because they come to your home, they do the testing, and then we get a diagnosis there. And then once you come back to us with the report, we refer you to the ENT specialist in-house. They will check your upper airway and then you come back to us, rule out all the other issues. And then ultimately we give you the treatment plan and also attach you with that person who is actually going to come and monitor for you at home. So how you are compliant with the treatment.
So you are describing the sleep as the third pillar for Respire.
Yeah.
So I know that's a integrated way of connecting both the ENT and the pulmonology.
Yeah.
So, like, what kind of a patient is eligible, or what kind of a patient should be considering for these sleep tests?
So I'll give you a case scenario. Just last week we had encountered one patient. So this patient came with complaints of snoring in the night and excessive daytime sleepiness, early morning headaches, and patient was seen by some general physician outside, and they had referred to a pulmonologist, thinking it is an obstructive sleep apnea. So the patient came to our clinic in a corporate setup, in the corporate hospital. All the imaging, everything was done pertaining to the lung. Okay. So once the patient walked into my clinic, the first thing we asked is, do you have any nasal issues? Like, running nose or, sinus headaches. So then we had sent them to the ENT specialist. He had done the endoscopy, checked for any upper airway obstruction, and then we had evaluated for her thyroid issues. She had a thyroid issue as well, which was causing her neck to be slightly swollen because of the thyroid. So ultimately, all these issues led to her issues with sleep. She was having breathlessness at night while sleeping. What we have to keep in mind is before you do the sleep study for such patients, you will get a positive test for obstructive sleep apnea. But that doesn't mean that these patients have to be put on the CPAP machine, which is the treatment for OSA. So we have to look at the correctable factors. Like, can this upper airway issue be corrected? If it can be corrected, then that will give a permanent solution to the patient. And you are preventing the patient from, getting attached to a mask while they are sleeping. So that's like a big burden for the patient.
Right.
Might not be very, it's easy to prescribe, but once the patient uses a mask, the pain of that using that mask at night only they will understand.
Right. I think most of the patients are not even aware of now.
Exactly.
Go to the EMT
Correctable
right?
factors. They are correctable factors.
Yeah. Like, most of them would just go as a lifestyle issue, reduce the weight, or and they are, and at the end of the day, they are put
Exactly.
to the CPAP machines permanently.
Yeah, if you don't have these issues corrected, and the mask will definitely give you some symptom relief. But the moment you are off the mask, at some point of time, the patient frustration kicks in. He will not use the mask for a few days. Symptoms come back.
Right.
So that is where this holistic care is very, very important. So we have this integration here. Apart from that, we also give you monitoring post whatever we have prescribed you, whether it's CPAP or whether it is surgery.
Got it. So if a patient offers a surgery for the upper airway, then it is almost the permanent solution.
The permanent solution.
Got it. But if a patient goes just for the lower airway corrections, then it will be just CPAP, get the relief with the symptoms.
Exactly. So even if just a pulmonologist is examining a patient of OSA, he will directly put the patient on CPAP. And that's what is happening in the market.
No.
Nobody is looking at the upper airway as a possible solution to this issue.
Exactly. So just for the viewers, the OSA is obstructive sleep apnea, right?
Yes.
So, like, most of them are not even aware of what is the difference between the sleep apnea and insomnia. Can you just explore a little bit on the topic?
Yeah. So insomnia is basically patient's inability to sleep at night. This could be due to multiple issues, not just the sleep apnea which we are talking about, but also due to certain neurological issues or functional issues of the patient, like phone addiction. So that's where the psychotherapy or the psychological counseling and this kind of personalized approach to the patient comes into play in cases of insomnia. That's what I'm talking about. These are we have certain non-medical causes of insomnia. We have some medical causes of insomnia. Medical causes we will be taking care, but non-medical causes you will need someone to counsel you and know what are your habits, how do you sleep at night, when do you sleep at night, and when is your last phone usage, and all those factors play a role in patients dealing with insomnia. So that is about insomnia. Sleep apnea is an entirely different thing. Sleep apnea patients come to us with predominantly snoring or suddenly waking up at night. We call it witnessed apneas in medicine. Okay. So the attender, the person who is sleeping next to the patient, they will notice that patient is suddenly waking up with choking and bedwetting and reduced sexual function and uncontrolled hypertension and vehicular accidents during daytime. It is happening.
Okay.
Even though it is not very widely known, but this is also one symptom of a sleep apnea patient.
Got it. So, if a person is sleeping and then snoring and then going through all these things, so at what point someone has to monitor for all these things so that they don't get into these issues?
Okay, so simple thing what you can do if you have someone who is snoring, just put a pulse oximeter. You must have seen in COVID, it is very popular. Just put a pulse oximeter and monitor for a few hours after he goes to deep sleep.
Okay.
Most commonly you will see that the saturation might drop a little.
Okay.
Just keep a monitor and just check. That is something you can do at home.
Okay.
Okay, so and also look out for symptoms like if he's having daytime sleepiness. And like we have a questionnaire for that. When he comes to the clinic, we offer few questionnaires and we ask them simple questions like, do you fall asleep when watching TV? And do you fall asleep or do you feel sleepy when you're driving alone, when nobody is there to talk to you?
Got it.
So in such situations, how do you feel? And based on that questionnaire, we have an objective number, and based on that, we characterize the patient, whether he's a candidate to go for a sleep study.
Okay, got it. So, like, let's say, from the patient point of view, like, the breathing issue, those who has a breathing issue is totally different. Those who has the ear, the ear issues are different, and then the sleep issues are different. But you're saying that, you have all under one roof, and if a patient comes here versus if the patient goes to just for, let's say, for sinusitis or let's say for breathing, right? Like both are totally different worlds of symptoms. If they right. So if they come here, what would be the holistic view that a patient can get about their symptoms?
So incidentally, I'll just tell you about one case which I had encountered just today morning. So we had a patient who was suffering from sinusitis. Okay, since very long, and he has been taking all sorts of nasal sprays, consulted multiple doctors outside. So and underwent an endoscopy. There were polyps inside. And when we probed into his history, he was telling us that he has allergy, dust allergy predominantly. And off late, he was having some breathing issues and less of breathing issues, but more of coughing. So then he went to the ENT naturally because of all these issues, sinusitis and all. So he came to me to give fitness for the procedure. They were planning to do a polypectomy. They were planning to remove the polyps.
Okay.
He came to me for fitness, like to give fitness for the procedure from the respiratory point of view. So when I examined the patient, probed into his history in detail, then got to know that he has a family history of asthma and he has been using aspirin. Aspirin is something which we use in old age, or it's a blood thinner basically for cardiac issues. We use it. And then before as a routine protocol in our center, we sent him for a pulmonary function testing. It's a very basic test which is widely available. So, and then few other blood tests. So when we connected the dots, he was found to have bronchial asthma. So why bronchial asthma in this patient? He doesn't even have much breathing issues. So this was an early stage of bronchial asthma, secondary to allergy, which was causing his sinusitis and polyps. So all these things are related. So if you have a patient of sinusitis, polyps, and he has a history of allergy, family history of allergy, blood tests pertaining to, indicating that, allergens sensitivity is there, then we evaluated for asthma. Ultimately, what happened? The ENT and pulmonologist had to come together, treat the patient as a whole. We deferred the surgery for now, put him on some anti-allergics and put him on some inhaled medications. And now we'll see how he is recovering. So this is about today's patient, but like that we have many more who have come to us like this.
That's right.
So
got it. It's an interesting story. Why it is important for a patient to think holistically rather than just looking at the symptom. But yet, most of the patients are not aware of thinking beyond of whatever they are going through. I think that's a good story for the viewers to listen so that they understand why a full airway clinic is much better compared with the fragment.
It's the need of the hour.
Yeah, definitely in 2026, it's definitely need of the hour, and also our AQI levels are going up.
Yeah, that is one thing we should be very, very worried about now. I think just recently, I think 3-4 days back, there was news that Hyderabad's AQI has also gone up to 400. I don't know if that was true, but
Yeah, even I was reading about it, and then particularly in the west part of the Hyderabad, a lot of constructions going on in the residential and the commercial. So, just on the same note, most airway conditions are chronic, and how do you like? How does Respire treat the short-term symptoms and then take care of the long-term quality of care for any patient? Because if a patient, as you said, if someone is put through CPAP machine, uh, it might treat the symptom, but the quality of their life is always attached to a machine, right? So, if someone comes here to a Respire, and then how does Respire treat it differently?
So what we do is, as I told you before, we are attached to few people who do these home visits and all. So I'll give you an example of, okay, now that you have taken the CPAP as an example, suppose I have given a patient a CPAP trial. So now what we do is, we don't ask the patient to buy the machine upfront. So we advise the patient, you take the pay machine for rent for 1 month
Okay.
and then see how you are compliant to it. If you are not compliant, we might, these machines come with different masks and different interfaces.
Right.
Okay. See, it's not one size fits all
Right.
for this. Okay. So we have to see how the patient is compliant with it. So all these CPAP machines and all these things, they come with a chip installed, and the chip is in direct connection with the dealer whom we are empaneled with.
Okay.
Okay. So the dealer will know how long he has used the CPAP, how has he tolerated the CPAP. So we are in touch with the dealer.
Okay.
When the patient has been sent to one particular dealer, we are in touch with him. So he gives us real time information that, this patient is not very compliant, this patient is compliant or whatever. So we call the patient after 1 month, and then this chip gives a printed report also.
Okay.
Okay. So the patient comes with that handheld printed report supplied to him with that dealer. Okay. And then we see the compliance, how he has been compliant or whatever issues. And then, okay, suppose the patient has been compliant, he's been using it. Then we ask him to use it for a longer period of time. I personally feel that after initial 1 month, I call the patient every 3 monthly or follow up.
Okay.
Okay. And then we follow up and we ask him, as we are told, no, these questionnaires which we have.
Right.
And we score him based on that. Okay. And then this is the medical part of it. The other part, what we can see in this sleep apnea patients is lifestyle modification, weight reduction. So we connect them through to some rehab centers,
Okay.
which are offering these kind of exercises. Now we have few patients who have OSA, also who are quite frail to do something to reduce weight. So we have certain people who come home and they do certain home exercises which the patient is comfortable doing. They don't have to exert and go out of their way. So that is something which we are doing.
Okay.
And that ultimately provides a holistic care for the patient.
Got it. So it is not
This is,
just
I am telling you in case of CPAP, as we
right. Exactly.
like for every disease it's different.
Exactly. But the common denominator is the holistic approach that you are taking.
Yes.
Not only from the medical point of view, but also from the non-medical point of view. As I said, maybe a psychotherapist, the analysis of their lifestyle habits, so that everything works in tandem.
Yeah.
So on the same note, you said whenever someone goes to this sleep apnea test or any other pulmonary test, there might be one issue or the other issue props up. So how does Respire think in a different way compared to the market? Do you just go by the reports and then start treating with the symptoms, or do you bring in the ENT so that you try to find more symptoms in the patient, or what would be the thought process so that if any patient visits here, they will understand, okay, I'll be getting the ENT consultation as well, I'll be getting the pulmonary consultation as well. So how does that whole holistic approach works at Respire?
Okay, so that entirely depends on what the patient is presenting with. So his presenting symptom will ultimately tell us that what systems need to be involved. Okay, so suppose patient is coming with cough, just predominantly cough. Rule out all the pulmonary causes of cough, extra pulmonary causes of cough, like patient is having sinusitis, for example. Then he will go to the ENT who is there here. We have the imaging with us in-house. So your X-rays, your PFTs, everything happen real time. So the patient is not having to, jump from one place to other place. So this is something which is, I think, an added advantage for the patient. And once we rule out everything, then we can attribute it to maybe a gastroesophageal reflux, and we put him on that treatment, and then see how he is doing. We call him up after 10 days, and then patient tells us like whatever the issue is, has it been sorted or not.
Got it. So you got all the tests as well here, the radiology tests. So
Yes, we have radiology, pulmonary function tests, and everything related to ENT and pulmonology is there with us.
everything under one roof, so that patient
It's
doesn't.
an added benefit for the patient. He doesn't have to go around here and there.
Yeah, I would say rather than a benefit, it is a need
Yeah.
as of today. So, are there any situations where
So, since you were talking about holistic care and the complete thing, we we get many patients who are suffering from COPD.
right?
The rising AQI and the increased prevalence of smoking. Many patients come to us that they want to quit smoking. So, first of all, we identify the patient who is really willing to quit. That is something which the doctor and patient has to sit and talk about. And if we see that there is a genuine effort from the patient, then we have smoking de-addiction clinics also. We run special de-addiction clinics on every Saturdays. So, specifically for these kind of patients to counsel them.
Okay.
Basically, a counseling from a doctor matters the most to the patient.
Right.
Like if a doctor is telling you something, then it registers more easily to the patient. That is like understanding the patient's psychology and talking to him in those kind of terms. So once we do the counseling, and if the patient is willing to quit smoking, and then we help him with certain pharmacological agents also, like patches or nicotine patches or something like that.
Okay. So, nicotine patches or any other solutions. So, do you monitor them continuously, or are they
No.
lifetime?
No. We have to monitor them every 2 weekly or 3 weekly. That's what we do.
Okay.
And basically, there are many options, like how you can give a patch, or you can give, it comes in a chewable tablet form also.
Right.
So, but the issue is in the market, you must have seen many ads, just pop in this thing.
Yeah.
And many patients complain that nothing happens. Many patients come to us with that. But what the issue is, they don't tell you what dosage needs to be given.
Right.
That will come only when that clarity will come only when you visit a specialist.
Exactly.
And you follow the dosage regimen, and then you will see the result only then.
Exactly.
But before all these agents, you need to be sure that you are willing to quit. If that is not there from inside, then these agents will not be of added benefit.
That's correct. So, just the OTC prescriptions are not enough. You need to get a personalized prescription from the doctor. So, on the other hand, are there any situations that you can describe where you just put a patient under observation rather than treating them right away with either the sleep issue or with other pulmonology issues?
Okay. So, this happened, I think, like in my training. So, I remember I was on night call, and there was a patient who was a student. He was a student. I think she was in college. I don't remember exactly. But she came with hyperventilation.
Okay.
She was breathing heavily. So, first thing what anyone will do, they will connect oxygen.
Right.
And oxygen surprisingly was normal for her.
Okay.
So, ER doctor, they connected oxygen. They started giving her some nebulizations, put her on some IV steroids, IV antibiotics, so on and so forth. So, one simple thing is just do an arterial blood. It's a simple blood test called ABG, and see how the blood parameters are, the blood gases. So, what we saw is in these kind of patients who are hyperventilating, call it very typical case history. This was before her exams. She got stressed, panic, anxiety, and hyperventilating. Did an ABG. So, since she was breathing heavily, she was removing a lot of carbon dioxide from her body. So, what happens is, so what we did is, we removed the oxygen, put her on a mask and sealed the whole mask. So, what happens is the carbon dioxide started going in again. She was rebreathing her own carbon dioxide.
Right.
Once the carbon dioxide levels came back to normal, she automatically improved. Apart from that, we counseled her for her anxiety and other issues which were because of her exams or something. That was the case. So in this case, what I mean to tell you, we didn't treat her with medicines.
Right.
We just used our presence of mind and used this completely seized bus to wean out to get off her symptoms.
That's a great story.
That is just a story, like many other issues like that, where you need to just observe and not treat the patient.
Okay. So let's go on the other side. Like, are there any patients that you have to intervene, either for the pulmonology or the upper airway, where the patient might have come to you just in a normal case, and then that might be converted into a serious case, so that the viewers can understand when not to ignore the symptoms.
Right. So if you have cough which is persisting for more than 2 weeks, it's always better to get evaluated. In our country, like which is endemic for tuberculosis, that is something which you need to get checked. And how you get tuberculosis checked is by a simple sputum examination or a chest X-ray. For that matter, we have some blood tests also, which can give you a clue whether this patient is suffering from TB or not. So certain warning signs are there for each condition. Like if you have uncontrolled breathlessness, which is not being explained by any other cause, like must have visited the cardiologist, nothing is popping up. You have to visit a pulmonologist to check out for, if you have some V's or something else going on. They will do a certain test like a simple pulmonary function test, a chest X-ray. And then if anything pops up in that, then the treatment will be directed towards it. Like we had a patient yesterday in our hospital where I work. He was admitted for a knee replacement surgery. The surgery was done and the patient was all okay, but his saturation started dropping. Patient doesn't have any symptoms. Saturation started dropping. We did the chest X-ray. Was showing a mass in the right lung. Okay. And then this patient started getting black sputter. We did a bronchoscopy. Bronchoscopy is nothing but we put a small camera in your lungs and then check what's going on inside. This patient had a mass in the bronchi, one of the bronchi. So ultimately turned out to be cancer.
Okay.
So what I'm trying to tell you is not every disease condition comes with a warning sign. So it's better to get evaluated on an annual basis. My personal opinion, if you're above 35-40, get an annual screening done for all these issues so that these kind of things don't get unnoticed. Okay, luckily this patient has a stage 2 and has been progress. But okay, he didn't have any symptom.
Right. So what kind of screenings you suggest for anyone above 30-35?
Annual low dose PET scan. That's what he suggests for cancer, for that matter.
Okay.
That is for cancer. So annually get the PET scan done. And see how it is. And if you go to the West, they do colonoscopy and all as a routine practice.
Right.
As a screening. Yes, is not happening in our country.
Okay.
So, but it is needed.
Okay. So, like, let's say if a family in Hyderabad suffering from either of these 3 issues, breathing or hearing or sleep issues, what is the one thing that you want to tell them from the Respire?
So, one thing I'll tell you from Respire is we provide integrated care here involving all the 3 specialties as we have been speaking about them. And not just these 3, but apart from that, we are also providing home care services, post your diagnosis and treatment, and proper follow-up will be ensured. And we are also in telemedicine. So in case you are not able to come from your workplace or your home, we can connect via telemedicine services which we offer.
Perfect. So is there anything else that you wanted to give the message to the users?
I think, one thing I would want to say is be aware of your symptoms. And as we had spoken about few pulmonary issues like cough, unexplained breathlessness, smokers issue, smoking induced cough. There are people who are treating all these things like, de-addiction centers, like what we are offering everything in one place. De-addiction centers, pulmonary function tests, imaging of the whole pertaining to the lung and ENT. And we are also offering allergy services. Allergy testing is being done, which are also providing immunotherapy to the patients. So we see many patients of asthma who are on chronic inhalers. They are frustrated eventually. But, all the time they are always allergic to, dust or, certain kinds of foods. So we are giving you something called immunotherapy. So what we do is we initially do the allergy testing. It's like a skin prick test, which we do.
Okay.
And then we identify what allergen you are allergic to. So we have a panel of almost 100 allergens which we test for. And suppose we find out that a patient is allergic to dust and certain kind of dal or food or whatever. So then we make certain immuno drugs against that allergen. And then the patient has to take them and place it under their tongue. And this therapy is prolonged, but it is useful. So ultimately, what happens is once the patient starts taking this drug and places it under his tongue and is under our follow up constantly, ultimately the patient will develop a sensitization towards that allergen. So eventually, he will not be allergic to that. So we are treating the problem from the root, not just the symptom. So that is what I want to emphasize, and that is how our center is different from others.
Perfect. Thank you, Dr. Kunal. And then whoever is listening to this video, if you are suffering from breath, if you are suffering from sleep, if you are suffering from hearing issues, Respire Airway Clinic is the place for you to come here, not just for the basic treatment, but to get the holistic treatment. As Dr. Kunal said, they treat from the root cause, not just the symptoms. If you cannot come and directly meet him, there is an option for teleconsultation as well. That's a great way to start. You don't need to come for every single symptom, but you need to know what is the root cause of your symptom. That's the way to go now in 2026. So Respire Airway Clinics is the way for you to get your treatment done.